Hello, this is Dr. Chris Marshall here with Medical Specialty Clinic. Today, we're diving into an essential topic of healthcare, colon cancer screening. There are several ways to be screened or checked for colon cancer, and tonight we're going to discuss the two best ways, or at least the two best ways that I know of for colon cancer screening. We'll compare two popular methods, Cologuard and colonoscopy, which I feel are the two best ways for colon cancer screening, and really the only two that I recommend on a routine basis. Colon cancer is a serious but preventable disease. It occurs in the colon or the rectum and can be effectively treated if caught early. Regular screening is crucial, but what are the options available? Well, first, we're going to look at colonoscopy. This is a procedure where a doctor will examine the colon using a camera and a light to look at the inside of the colon wall, which is where colon cancer occurs. So colonoscopy is very accurate, and they can actually remove polyps or small early cancers before they turn into major problems. So the process of colonoscopy is a little invasive. The day before, you have to take a colon cleanse, and so you're in the bathroom quite a bit because you have to clean out the colon where they can see everything very well. So if you don't get a good prep, that can decrease the effectiveness of the colonoscopy. One of the best things about colonoscopy is that if it's normal, you only have to have it every 10 years. If it's positive or if there's some polyps removed, you'll have to have it a little sooner, but you'll discuss that with your doctor when they do the test. Cologuard, on the other hand, is a non-invasive DNA stool test. You can do it at home. They will send you a kit to your house. You collect the stool sample, package it, they pick it up, and then they run it at the lab. So if it is positive, meaning if there's DNA there, the test is reported as positive, and then the next step is typically a colonoscopy. The recommended frequency for Cologuard is every 3 years. So the pros and cons of Cologuard versus colonoscopy are a Cologuard is easier to do. There's no big prep. You can do it at home. You don't have the trouble of going to another doctor's office, having a procedure. There's no complications from it. You can have a false positive. In that case, you would go get a colonoscopy. But in general, it's very easy, very safe, and it is a reliable test. I'll put up some numbers comparing the stats from the Cologuard website. Colonoscopy is less often, but it's more invasive. So the Cologuard, you get every 3 years. Colonoscopy, you get every 10 years. Downside to the colonoscopy is you got to take the prep for the day before. So usually you have to be at home. You can't plan to do a whole lot of stuff the day before. Then you go to the hospital, you have the test done. It's a procedure. There can be complications from it, but they're low risk of complications. And then one of the best things about colonoscopy is it's reliable. You can see the colon and they can also treat it. So if there's a polyp there, they can take it out, and that polyp, which may be precancerous, never turns into cancer. So it's taken out before it even becomes cancer. It can also, if there is a cancer there, they can biopsy it while they do the colonoscopy, and that helps determine what treatment is necessary. So in general though, if it's normal, you only have to have it every 10 years. If it's positive, if you have certain types of polyps, you're going to have to come back and repeat that a little sooner, but that will be determined by the test results, and your doctor will go over that with you when they let you know about the results. Both methods have their place in colon cancer prevention. The best choice depends on your health history and risk factors, and always consult with your doctor before deciding which way to go, but certainly be able to discuss both of those tests. There are several other ways to do colon cancer screening. We used to do where we check for blood and things like that, but typically that presents later by the time there's blood, and so these tests are just a lot better. You're actually checking for cancer cells or DNA, or actually looking at the colon and getting tissue samples while you're there. So you really want to consider one of these two tests for colon cancer screening. Thanks for watching. Don't forget to like and subscribe, and also share the video. If you would like to discuss this or any other healthcare problem or concern in more detail with one of our providers, just give us a call at the office, 731-257-1500. I'll see you in the next one.